Hi, welcome to Consider This, Simplifying the COVID-19 Conversation. In this fourth week of our series, we'll be talking about the pandemic in athletics with Athletic Director Jack Swarbeck and Chair of the Faculty Board on Athletics, Tricia Balia. I wanted to follow up with a concept that we discussed last week with Dr. Mark Fox about contact tracing because it's relevant for this fourth week of the discussion, but also because we've been receiving several notices that individuals who think they're a close contact, so a colleague at work who's been infected, or a friend or family member, and then the contact tracing team doesn't call them. And so I wanted to define what a close contact is considered. So what is a close contact? It is when you are within 6 feet of an infected person for greater than 15 minutes. And so this isn't just like when they're coughing and spewing, but even within 2 days prior to symptoms. So if you remember our graph of viral load, that you're actually infectious probably within 2 days before symptoms arise, or you have enough virus to have a positive test. So a close contact is defined up to 2 days prior to symptoms onset, or if they have symptoms and you've been in with 6 feet for greater than 15 minutes. Importantly, this is with or without a mask. So even if you're in close contact for 6 feet, for 15 minutes within 6 feet with a mask, you could be defined as a close contact. So how does this relate to college athletics or athletics in general? Well, lots of sports are considered contact sports, and so that you're constantly in contact with other individuals, especially the opposing team. So I tried to find some data that assessed in certain sports how many times people were in contact. And I was only able to find one paper in a sort of an obscure journal. But what they did is they tracked 4 professional soccer players. This was in Hong Kong, so it's considered football, over the course of the game. So 3 forwards and 1 midfielder. And then they quantified how often that individual was in close contact. And for this paper, they defined close contact for 4.5 feet instead of 6 feet. And they quantified the minutes that these individuals were in close contact over the course of the game. And so you can see that varies quite a bit. This forward was only in contact with someone else for about 6 minutes, where this midfielder was over 35 minutes. So the mean or the average was about 19 minutes. So that's over 15 minutes. But importantly, that 19 minutes was actually in close contact with different individuals. And so really not 15 minutes with one individual. So really all those people would have to be infected, I guess, to be considered a close contact. They also assessed other behaviors that might lead to infection, like touching the mouth, eyes and nose, and spitting. And you can see some individuals have lots of those behaviors where others do not. So in terms of sports in the United States, I wasn't able to find any published data that I could review, but I did read a Sports Illustrated article that indicated that the SEC is monitoring how much time their football players are spending in contact with people of the other team. And only 2 positions, the center and nose guard, were the individuals in contact for greater than 15 minutes. And I think it was like 18 minutes. So this suggests that likely, at least in football, getting infected by someone from another team is probably unlikely, and more likely that your transmission will occur between members of the same team, either in the huddle or on the sidelines. And so that's why players are asked to social distance on the sidelines, wear masks on the sidelines, and non-essential personnel are not present. So what happens if you're defined as a close contact? Well, the CDC suggests that if you have been in contact with an infected person for greater than 15 minutes within 6 feet, and you have not been diagnosed with COVID-19 within the last 3 months, that if you have symptoms, obviously you will isolate for 10 days and undergo testing and medical care. If you have no symptoms, you're asked to quarantine for 14 days and undergo testing. So some people are asking, why 14 days if you have no symptoms and only 10 if you have symptoms? Well, if you remember our graph, that by the time you have symptoms, you've probably already been infected for up to, 5 to 7 days, or even say 3 to 4 days. And so by the time you have symptoms, you've already been infected for a while. And so that's why it's only 10 days. So now what happens if you're a close contact, but you have been diagnosed in the past 3 months, either diagnosed by RT-PCR or some other diagnosis testing strategy, or but just by a healthcare provider? Again, if you have symptoms, you isolate for 10 days, undergo testing and medical care. But if you have no symptoms, it's not suggested that you quarantine. Likely because if you've recovered, you probably have some antibodies, and the chances of you actually being infected enough to be able to transmit are pretty low. So what happens for our college athletes? Well, as we're a member of the ACC, the testing rules are that collegiate athletes be tested 3 times per week. For football, they need to be tested the day before kickoff of any game, and that has to be done by a testing facility that's designated by the ACC and not by the school or the University of Notre Dame. In addition, they're tested 48 hours after the game. For other sports, other than football, the criteria is to be tested 3 days before competition. So if you receive a positive test, the athlete has to isolate for 10 days, undergo testing and treatment, etc. And then importantly, they have to undergo a cardiac evaluation prior to going back to practice and competition. And that's because some athletes have been diagnosed with some myocarditis following COVID-19 disease. Now, if a player is deemed a close contact, so has been within 6 feet of an infected person, with someone with a positive test for greater than 15 minutes, which you can imagine could happen a lot on a team, they're asked to quarantine for 14 days as per CDC guidelines. So that's a little bit different than what the guidelines are for our other students or non-student athletes and staff. So if you're deemed a close contact, on day 1, you go into quarantine. On day 4, you receive a PCR test. If you're positive, you move to isolation. Remember, infected, isolation, I. If you're negative, you stay in quarantine, and then you're given another test, and a rapid antigen test on day 7. Again, if you're positive, you move to isolation. If you're negative, you're released from quarantine. So that's 7 days versus 14 days. And that's because our student athletes have to follow the rules of the ACC and the NCAA. Well, I'm looking forward to our discussion, and I hope to see you soon.